Welcome to the Osteoarthritis Action Alliance Lunch and Learn for November 16th, 2016. My name is Kirsten Ambrose, and I wanted to thank you all for joining us today. I'm pleased to introduce our presenter, Nick Turkas. He is the Director of Consumer Support at the Arthritis Foundation. Mr. Turkas began his service with the Arthritis Foundation in 1999, initially serving as a local branch program director for rural and Appalachian Central and Southeast Ohio counties. He was promoted then to Director of Programs and Service for the Central Ohio chapter and managed programs for better living, public education events, family days and camp, state advocacy, and in-home occupational therapy program, and all grants and United Way applications. Then in 2010, he relocated to Charlotte, North Carolina to lead the health and wellness programs at the Arthritis Foundation's newly formed Mid-Atlantic region. And in this role at the home office, he oversees the Helpline, the Arthritis Resource Finder data, the knowledge base, and provides trainings and technical assistance to field staff. So in today's webinar, Mr. Turkas will give us a tour of the Arthritis Foundation's newest tools and resources to help people conquer arthritis. Welcome, Mr. Turkas.
Thank you so much. It's my pleasure to be here to talk today about the Arthritis Foundation's help and support tools. I want to provide some information about what those tools are, how those tools work, how these tools can be shared and be of benefit for all the people with arthritis. So I want to thank everyone for being on the call today, and especially thank you for your interest in the Arthritis Foundation and the cause of conquering arthritis. So as I said, we're going to talk about tools and resources. The Arthritis Foundation has tools and resources for the point of care, tools that are online, and tools that can be accessed in the community. But first I'm going to give a quick overview of the Arthritis Foundation. We all know that arthritis is a huge problem, 50 million people, leading cause of disability. The Arthritis Foundation was formed in 1948. And we are the largest voluntary health care organization that's dedicated to the prevention, control, and cure of arthritis. We've been helping people access optimal care, sharing must-have information and tools, and creating communities of caring individuals, families, and teams. We are a trusted source. We take our role very seriously in that we are the second most trusted organization other than healthcare providers when it comes to finding out ways to manage your arthritis. So we need to make sure that our tools are in fact helpful and are accessible. At the Arthritis Foundation, we are boldly leading the fight with life-changing resources for help and support. We have four main pillars at the Arthritis Foundation's mission activities. So many people ask me, what does the Arthritis Foundation do to help people with arthritis? So we have a help and support team, scientific discovery looking for treatments of arthritis and diagnostics, advocacy and access, and community connections. Primarily, I'm going to be addressing the pillar of help and support, but there are many ways to get involved in the Arthritis Foundation's mission activities. So I love this slide, and I use this slide in just about every presentation that I do because it really helps show why we're doing what we do when it comes to help and support and the tools and the resources that are available for people with arthritis. For many years, the Arthritis Foundation offered many programs and services to the community that evolved over the long history of the Arthritis Foundation. Many of you that have been involved with the Arthritis Foundation are probably familiar with this evolution, or in fact, we've had a pretty significant revolution when it comes to our help and support tools or the programs and services that we offer to the community. Many of those programs were around for a long time, and they served a very important role. In particular, we had developed some exercise classes that were very helpful for people with arthritis to become active at a time when many people thought it was dangerous or unsafe, or people did not have access to training when it came to physical activity for people with arthritis. And so the Arthritis Foundation developed the Arthritis Foundation Aquatics Program, exercise program, partnered with the Tai Chi for Arthritis and even Walk with Ease, which we still continue to feature. Those programs are excellent and still available in the community. But what we did a few years ago, about 2 years ago, is we went back to people with arthritis, and we conducted an exhaustive survey, focus groups, and really talked to people about where do you get information about arthritis? What do you want to learn about arthritis? How do you want these tools to be available for you? And what we found is that people really are going online. They're going to their computers to find out information about arthritis and its management. They are going to their doctor. And the Arthritis Foundation had somewhat neglected our role as working with healthcare providers, and that has significantly changed. And we are still in the community. We have a national footprint. There are more than 150 offices of the Arthritis Foundation across the U.S. in just about every state and every major market of the country. We have staff and volunteers that are engaged with the Arthritis Foundation and can help people find tools and resources of the foundation. We create great content. We help people get connected, tools and resources that will ultimately build and engage relationships with people with arthritis. So let's talk about these tools and resources. Most importantly, the guiding principle of our tools and resources is this first bullet here when it comes to priority outcomes, and that's empowering people to live better with higher quality of life and less pain. So that is one of the goals of all of these tools and resources. So many of these tools and resources can be accessed on arthritis.org. If you've never been there, I encourage you to go to arthritis.org. You don't have to go right now, but it's an excellent website and it has a lot of information. The majority of the tools and resources that I'm going to talk about today are under the Living with Arthritis tab. There is a tools and resources. It's the first header under Living with Arthritis, and you'll be able to find all this great information that I'm talking about today. When you click on that, you will find this Tools and Resources page, and there's some fancy sliders and some headers that will help you find the tools and resources that I'm talking about today. Many of these tools and resources have their own direct URL, something that you're interested in as well. So first I want to talk about point of care. And when I say point of care, I mean patients working with healthcare providers to improve their health. And, you know, intuitively, we know that healthcare providers play a critical role in patient care. We know that early proactive interventions are vital to people with arthritis. Our consumers have told us that they value advice from their healthcare provider over any other source. And at this time, healthcare providers were unlikely to recommend Arthritis Foundation its help and support services. That may have been true about 2 years ago when we did some surveys. We found that very few healthcare providers were actively recommending Arthritis Foundation as a resource. And so we work to change that. And today we have some new tools that encourage better engagement with healthcare providers, with patients using some of these tools and resources. These tools and resources have a real value to healthcare providers in that they're non-commercial and they provide unbiased information. They help with self-management. They help collect relevant data, and I'll talk a little bit about that for both the patient and the healthcare provider. It expands the options for treatment. It encourages physical activity, and it reduces clinic staff time researching resources. So let's start with the Digital Better Living Toolkit. This is a really rich tool. And at first glance, you could say it's another website, but it's just so much more than that. The Digital Better Living Toolkit, first of all, is free and always available, and that's something that's really important. We want tools that people with arthritis can access anywhere they are. That is, at their computer, their laptop, their tablet, or their smartphone. They can find access to this tool. And these resources include information about your arthritis, understanding what arthritis you have and how it's affecting your body, a health tracker, goal setting, and tips for communicating with your physician. So there's a great panel on understanding the basics of your arthritis. I'm going to get fancy here and use the drawing tool, maybe. Here we go. Here we go. Rheumatoid arthritis, psoriatic arthritis, and managing your pain. So osteoarthritis and other forms of arthritis. You can find these links will take you to more detailed information about that form of arthritis. So that's first. Next is a health tracker. So in order for people with arthritis to understand and manage their arthritis, they really need to set a baseline. The tracker is based on the Rapid3. It's a proven tool widely recognized by rheumatologists to track, in particular, inflammatory arthritis, but it can be applicable to people with osteoarthritis as well. It's important because the results are unique to the patient, but they're also meaningful to the physician. So when the Arthritis Foundation was in the development of the Better Living Toolkit, both the digital and the paper version, we originally came up with the idea of giving people with arthritis a health journal. And we took that idea along with all of the other ideas about how this Better Living Toolkit would work, and we told doctors, hey, great, we're going to put this health journal in there, and then you can read about the patient's journey and understanding what's going on in their life. And physicians told us, if you do that, we will never read it, essentially. They were very honest in saying that that was not a great way to communicate information about a patient's symptoms and their history because, quite simply, they just do not have the time to read through a health journal for every patient. And so what they suggest is that we use a diagnostic that physicians use, and that's how we came to the Rapid3. And the Rapid3 can track activities of daily living, pain, sleep, emotional health, physical function, and overall well-being. And what's great about this tool is that you can fill this tool out once a week, and you can see here there is a way to download a tracking sheet, and then you can record your Rapid3 score once a week, and then you can take that score into your physician's appointment, and it will give the physician a much better understanding of how you're trending when it comes to your health. So are you doing better? Are you doing worse? Is there something that you did that may be affecting your health? Did you change a treatment? And the physician can get a much better understanding of maybe what's going on with your body in the past quarter or 6 months since your last appointment versus just filling out maybe that snapshot every physician's appointment. So it provides a much richer description of how you're doing. And in our surveys, we find that people are using this tool. We asked people about it. The score, again, is a numeric score. It's very easy for a physician to take a look at these weekly scores. It's easy for you to look at these scores. And once you understand where your health is at, you can make plans to change it. So that's why we have in the tool, we have the goal setting. So setting goals is important to people with arthritis because, and for healthcare providers, because in order for healthcare providers to help patients, they need to understand, what their goals are. For some people with arthritis, it may be that their goal is to just be able to have the strength to hold a pencil to complete the Sunday crossword. But for others, they may want to plan a trip to hike the Grand Canyon. So different patients have different goals, and the goal-setting tips will help you understand help your physician understand what your goals are, and then it'll also take you through an exercise to meeting those goals. The Digital Better Living Toolkit also comes in a paper form. This can be ordered online or on the phone. Many of the same materials that are on the Digital Better Living Toolkit come in the paper form, but the paper form also comes with a jar opener and a copy of Arthritis Today magazine. There's also 3 different versions of the Better Living Toolkit. So you can order an RA kit, which includes the health tracker, the Psoriatic Arthritis Toolkit, which includes some special information about psoriatic arthritis, and then the general or pain kit, which does not include the health tracker. It instead includes a drug guide. But you may order any of the kits based on the information that you'd like to receive. Next, I want to talk about some online resources. The next is the Arthritis Resource Finder. So we know that finding local resources can be challenging, from which rheumatologists in your area to fitness centers, pharmacies. People with arthritis need to find local resources in their community to help them manage their arthritis. So the Arthritis Foundation's Resource Finder makes it easy to find exercise programs that's right for you, doctors that are close by, all at the press of the button. You can go to www.arthritisresourcefinder.org and get those local resources, or again, you can find it through arthritis.org. So what's nice about the Arthritis Resource Finder is that it's a searchable, comprehensive, web-based directory of Arthritis Foundation, community programs, healthcare providers, and arthritis-related business and services. Searches can be filtered by zip code within a mileage radius, and the resource is free and consumers are not required to register or create an account. The information comes from a mix of Arthritis Foundation data, but we also work with a professional healthcare data company that helps us keep the information about healthcare providers up to date. And that information comes from about 250 online directories. And then also we have the benefit of our national footprint where local staff actually, call on physicians, pharmacies, and all these businesses. And if there is ever an inaccuracy on the Resource Finder, they can submit changes to me, and I can have them reviewed and updated. But again, these resources are constantly being checked against online resources. So the categories, again, in the Resource Finder are Arthritis Foundation community resources and events, and those are things like public education events and expos, healthcare professional resources, and those include rheumatologists who see children, orthopedic surgeons, and primary care physicians at this time. We've got fitness professionals and groups, and I'll show you that, and then community healthcare resources, and that includes pharmacies, massage, in-home medical and non-medical care, and durable medical equipment sales. So for the group fitness programs, we have a long list of both evidence-based and non-evidence-based programs, interventions for people with arthritis. So the evidence-based programs like Active Living Every Day, the Arthritis Foundation Aquatics and Exercise programs, Fit and Strong, and Tai Chi. And then we also list a number of other programs, including Operation Change, which is a program that is geared for underserved and minority communities to help them exercise and set goals to improve their health. Walk with a Doc, which is a national walking program where folks in communities walk with healthcare providers. Walk with Ease, our signature walking program. Yoga for Arthritis, and Zumba, but I would specify and say it's Zumba Gold and Zumba Gold Toning. So they are the lower intensity Zumba classes that are offered on that program. But here's where you can help me. I am always on the lookout for new and innovative or existing programs that would be a good fit for the Arthritis Resource Finder. There's a process to vet these programs, and I'm talking about hiking, bar classes, other yoga classes, other Tai Chi classes, biking programs, any kinds of community exercise programs that are offered throughout the community, ideally in multiple sites. I would be very interested in reviewing those programs and seeing if they would be a good fit for posting those programs on the Arthritis Resource Finder. When we started with the Resource Finder, we had maybe just a few of our Arthritis Foundation programs listed, but we've been adding programs as it's been appropriate throughout the past 2 years. So again, Nick Turkas and Turkas@arthritis.org. Send me a note if you think you'd like to see something on the Resource Finder. We also have the Your Exercise Solution tool, and I'm really excited to say that this tool is available online through a website. It's mobile friendly, but also you can access it as an app on both the Apple and Android stores. So we all know that exercise is proven to reduce arthritis pain. However, less than 1/3 of people with exercise because of fear that it might hurt them, or they're not really sure what exercises to do. A great example is, there's a gentleman who loved to play golf, and he developed arthritis in his hip. Swing is very painful. He stops playing golf. That's not a good thing. Or we may have someone that had enjoyed a step exercise program, and pain in their knees prevent them from going back to the class. Or you may have people that have pain and want to get into an exercise program. They haven't exercised for a long time, but they're not really sure what program would be a good fit for them or what type of exercises they should or shouldn't do. So this is why we developed the Your Exercise Solution tool, and really there's nothing on the market that exists like this tool. It's very, very comprehensive and very helpful. It was developed with the help of a blue ribbon team of physical therapists, rheumatologists, orthopedic surgeons, and the CDC and the Arthritis Foundation experts. And you can see on this little screenshot here, you can mark what joints are affected with your arthritis, and then you can also show what activity level that you're at, whether you're inactive, moderately active, or active. And you put in, just that quick information, and then 26 different exercise options. Again, everything from hiking, golf, tennis, swimming, aerobics, dance, biking. There will show you modifications that you can make to make that exercise program appropriate for you. There are more than 4,000 variations based on where your arthritis is and your activity level. So it is very comprehensive, and it's not just, even when I first heard of this tool, I was afraid that it would have maybe a paragraph or two about the exercises that you could do and how to change them. But the results are quite comprehensive. Some of them are a few pages of recommendations. It includes pictures. You can see this pretty advanced pigeon pose yoga on the screenshot, but again, it is very appropriate for people of all physician levels. This is a great tool for physical therapists to use to say, hey, your physical therapy is ending, and we want to get you out in the community exercising, and let's find a tool that will work. Let's find a program that will work for you and the modifications that you can do to make sure that you're active. So great tool. Really hope you'll check it out. And then the last new online tool is brand new online, and that's Breaking the Pain Chain. And Breaking the Pain Chain provides some very comprehensive tools about managing arthritis pain, understanding how pain occurs in the body, how you can treat your pain, and a pain management plan that you can work with your physician. This is a tool that was developed actually in the community, in the classroom, particularly in the Midwest part of the country, and the results were great, and people loved the program, and so we decided to make a lot of the content available online. Available programs in the community. The Arthritis Foundation now works with Arthritis Introspectives, where we've merged, and we offer arthritis peer networks or support groups for people with arthritis. They're offered in about 30 different communities right now, but we're actively engaging new leaders to lead these peer networks. We want to get people together with arthritis to find solutions to their problems. Everyone that's involved in these peer networks have been vetted and trained by Arthritis Foundation staff, and it's an online training, and so it's accessible all across the country. We also have a new helpline. This is a toll-free number that's available 24/7, that's staffed by social workers that can help with answering questions about all sorts of things. They can answer questions about access to care, working with your physician, finding a physician, financial assistance when it comes to medication and durable medical equipment, dealing with denials to insurance companies or disability, finding support groups, finding transportation, a whole host of issues that people with arthritis often find because of their arthritis or because of their financial situation. This is a great tool for them. We also have our Walk with Ease program, again, offered throughout the community. But again, this program can be done in self-directed or in group formats. We always are encouraging people with arthritis to get walking and get moving. The materials can be purchased online, or you can even find them as an e-reader, as a Kindle version as well. Our award-winning magazine, Arthritis Today, is a great source of information for people with arthritis. And I am, every presentation, I'm contractually obligated to mention our wonderful Jingle Bell Run and Walk to Cure Arthritis programs. These are great ways for people with arthritis and the community to get involved and help fight arthritis. We've got other great resources too, like a new online tool called Wipeout Gout. We're launching Living Your Yes with RA educational programs throughout the country. They'll be in 30 markets next year. So we have a few minutes of questions. Questions about tools and resources or how you can be more involved?
Thank you, Nick. Really wonderful presentation. And just to remind folks that you can chat your questions in that lower right-hand corner in the chat box. And just appreciate the Arthritis Foundation's dedication to developing this great collection of resources that I think are really useful for folks. I think probably the biggest challenge, as with everything, while we wait for folks to type in some questions, is getting the word out about these, and things like this webinar today is a good way to do that. But thinking back earlier in your presentation about the healthcare provider side of the equation, and how do we ensure that healthcare providers are aware of this great resource finder and the tools that you've got there such that they can easily refer their patients to them. We've talked at the OA Action Alliance behind the scenes in our working groups about getting into electronic medical records or somehow getting these resources at the fingertips of physicians so that it's easy for them, or other healthcare providers, easy for them to give those out. Have you guys made any strides specifically in best ways?
Yes, we've got two major prongs. So one being involved in physician conferences and events where we've got a booth at the ACR if you're dialing in from there, but also many of rheumatologists, orthopedic surgeons have state and metro conferences, and we try to be available at those conferences. And the second is really just getting in the car or, and driving out to physician offices. There's nothing will replace a handshake, looking someone in the eye and showing them the tools and resources. And so the Arthritis Foundation, believe it or not, we did not have a strategic list of all of the rheumatologists and orthopedic surgeons, and now we do. We have a list of them all, and we can tell you exactly when we've met with them, what we shared with them, and their current engagement level of all the physicians. And so it's really taking the strategic approach of who do we need to go out and see, and targeting, healthcare systems and physicians within systems. So if there's Dr. Smith and Dr. Jones work within the same system, and we know Dr. Smith and we don't know Dr. Jones, when we go to meet Dr. Smith, we say, how can we get an appointment with Dr. Jones? You work for the same hospital system. So help us, get that relationship together. And so a lot of it is just, again, putting a plan together, targeting, prioritizing those physicians who we haven't met and haven't seen our materials, and getting out there and doing it. But we're always looking for volunteers to help us with that as well.
Great. Something like this is such a huge endeavor, and it takes, there's enough on the front end to put it all together between the lists of rheumatologists you were just describing and just the collection of resources that you have, and then to maintain it over time is really quite a task. So I certainly commend the Arthritis Foundation, all the work that you've done, Nick, and your team to get this going. So, certainly you had offered to folks to reach out to you if they have any questions or additional resources to add from their communities. I would reiterate that and really encourage people, if you think something's missing or could use a little bit of enhancement for what the information already is, don't be afraid to reach out. We'll be happy to help that, whether you email the OA Action Alliance or email Nick directly. So we are at our 30-minute half hour, so for those folks who do need to go along the way, I've just put up just a quick plug for our Tai Chi for Arthritis. This is one of the programs that is in the resource finder, and we are going to have a presentation pre-recorded because Dr. Lamb, our presenter, resides in Australia, so it makes for a challenging live presentation. But we will have that, some scientific evidence and demonstration in his presentation next month. So you'll get a better feel for that particular resource to then seek it out in your community on the Arthritis Foundation's resource finder. So if nobody has any questions, I want to thank everyone for joining us today, and especially to you, Nick, for showing us all the great things that you've got on the Arthritis Foundation's website. Very much appreciate it.
My pleasure. Thank you for the opportunity.
Thanks, everyone. We'll see you next month.